I'm sure you've all been sick before, and you've all had a doctor take your medical history. History taking is a really important skill to help diagnose and treat patients. And in fact, it's so important that today's medical students learn to take histories as soon as they start medical school. Medical students typically learn to take histories in the same way that you would practice for a simple job interview, with a friend or a colleague role-playing as the interviewer. But this traditional approach to practicing history taking has two main problems. The first problem is that it's time-consuming for medical students to find friends and family to practice with. And it's often the case that students spend more time finding people instead of actually practicing the skill. And once you do find someone to practice with, the second problem is that the experience is just not realistic, as they may not respond and react in the same way that a patient would. My name is Sahil, and being a third-year medical student that has personally experienced these problems, I set out to build my own solution so that I could practice taking a history whenever and wherever I wanted. That solution is 3D virtual patients. It's kind of like talking to Siri, but instead she's now a sick patient, and you can ask her a series of medical questions about her health. With a solution like this, students can practice with a 3D virtual patient and gain quantifiable feedback through checklists, saving them valuable time and giving them insights into how they can improve their history-taking skills. Since launching my beta last month, we've had over 100 virtual patient histories taken on our platform. And this amount of extra practice may never have been achieved had this platform not been created in the first place. And it's not just medical students that learn to take histories, as students in other health courses are also required to take histories from patients, such as physiotherapy, paramedicine, and nursing, making this the perfect opportunity to collaborate with Australian health schools and build virtual patients for their curriculum. And once we capture the Australian market, we can tap into the international market, training millions of health professionals to take high-quality histories from patients. We first plan on targeting the healthcare sector, but our long-term vision is to create a multi-industry platform, teaching future police officers how to interrogate criminals, lawyers on how to handle depositions, or even helping you land that job you've always wanted by practicing with a 3D digital interviewer. The possibilities are endless, and if you or someone you know is involved in the health tech space, I would love to connect with you. Thank you.